So evaluation of infertility. So when trying to determine infertility, both the female and the male partner are going to be evaluated. A thorough history and physical exam is going to be done to identify any underlying conditions that could be causing it. So they're always going to start testing with the more simple, less invasive procedures first, and they'll advance to the more complex. And then with an older female, they are going to accelerate this testing process just because of the natural decline in fertility as you age. So the male testing, the first one they will do is a semen analysis. The semen is best collected by masturbation, but it can also be collected through a non-spermicidal condom. They can also do an endocrine test. This determines if the hormonal stimulation that is necessary for sperm formation is present or not. An ultrasound can be done. This just helps to identify any anatomical abnormalities. And then the more invasive procedure would be a testicular biopsy, and this just gets a sample of testicular tissue for analysis. So here are some pictures referencing the male testing. On the left-hand side, that's just going to be a semen analysis report. So when they look at the semen, they're going to look at the total sperm number. They're also going to look at the motility of the sperm, the vitality, and also the pH. And then on the right, that is just a testicular biopsy being performed. So for the females, the first one that they want to do is predict ovulation. So if they do have a regular menstrual cycle, ovulation is going to occur 14 days before her next period starts. There is also a method using body temperature to calculate ovulation, but it's not as accurate. And then you can also tell them to purchase ovulation tests, and this detects a surge in the luteinizing hormone, and that just indicates ovulation is about to start. So another test they can do is an ultrasound to also just detect any anatomical issues. And then the postcoital test, this is done about 6 to 12 hours after intercourse, after the male has ejaculated the sperm inside of the vagina. Using an ultrasound, the sperm is then visualized to see how it reacts in that cervical mucosa of the woman. So some endocrine tests to evaluate the hormonal stimulation of ovulation are also done. And then some more invasive tests include a hysterosalpingogram. This is an X-ray. It uses contrast medium to visualize the reproductive structures. So with this test, you will need to remember all of the nursing implications that go along with using contrast medium. So remember to check for allergies, assess kidney function, and so on. An endometrial biopsy takes a sample of uterine lining to determine its response to hormones. And then a hysteroscopy and a laparoscopy, they both use an endoscope, but with the hysteroscopy, it goes through the vagina to visualize the uterus and the cervix. And with the laparoscopy, it enters the abdomen to view the pelvic organs. So after a laparoscopy, shoulder pain is common, and that's just due to the carbon dioxide gas that's inserted to help create space in the abdomen so they can visualize what's in there. This pain should go away in a couple days. And then after a hysteroscopy, there may be some mild cramping or bleeding, and that could last for a couple days. But she does need to know that she should avoid sexual intercourse for 2 weeks afterwards. After both procedures, if there's any fever or severe abdominal pain or heavy bleeding or any signs of infection, make sure she knows to call her doctor immediately or go straight to an emergency room. So here are some pictures. On the far left, that's going to be a hysterosalpingogram. The middle picture is of a hysteroscopy, and then on the right is a laparoscopy. Some therapy for infertility. This is going to depend mainly on the cause. So one method they could use is medications. So for the man, they could give him medications to help with semen quality or with erectile function. They could give the woman medications to help with inducing ovulation, preparing uterine endometrium for pregnancy, or for supporting a pregnancy once it's been established. Medications are typically continued 6 to 9 cycles in order to be effective. And you can use a combination of drugs. This helps mimic the natural hormone function. So when giving medications to induce ovulation, there is an increased risk for multifetal gestations. This in turn creates an increased risk for maternal, fetal, and neonatal complications later on. There is also a risk that the woman could develop ovarian hyperstimulation syndrome, so just make sure that she is aware of those before any medications have been started. So some common medications that are used, the first one is bromocriptine, also known as Parladel. This corrects any excess prolactin secretion by the pituitary, which then stimulates ovulation and helps support pregnancy. Clomiphene, also known as Clomid, that one induces ovulation. It can be used in conjunction with the HCG. Gonadotropin releasing hormone, or GnRH, Lutripulse. This one stimulates other hormone production, which therefore stimulates ovulation and production of testosterone in sperm. The Leuprolide or Lupron reduces endometriosis. Menotropin or Pregonal stimulates ovulation and sperm production. Neferlin Cinerel reduces endometriosis. It stimulates ovulation and spermatogenesis. Progesterone helps promote implantation of the fertilized ovum. Sildenafil or Viagra increases erectile function in the male. And then HCG or Pregnal stimulates ovulation and sperm production. So, of course, all medications do have side effects. So some common side effects of infertility drugs as a whole is going to be bloating, headache, breast tenderness, upset stomach, hot flashes, or mood swings. And then each medication has its own side effects as well that you'll have to just delve more in detail to. So make sure that the patient knows if she experiences any changes in vision or blurred vision, that should be reported to the doctor right away. Also, if the side effects get too difficult to manage, they should discuss with the doctor for some different options. If the patient does experience some side effects, there's a couple of different tricks you can tell them. So if they have a headache or cramps, tell them to use Tylenol or acetaminophen. They should not use ibuprofen or naproxen because these can interfere with ovulation and embryo implantation. If they experience hot flashes, tell them to dress in layers just so that it's easier to, take a layer off every now and then. And then for bloating, tell them to wear yoga pants or sweatpants or a long flowy dress just to reduce the constriction on their stomach. Some more therapy methods, they can do surgery. This can correct any anatomical abnormalities like tubal obstruction or adhesions or like a varicocele. They can also do therapeutic insemination, which is formerly known as artificial insemination. This can use either the male partner or a donor's sperm. The sperm is then placed directly on the uterus after it has been washed and concentrated. This just helps improve chances of fertilizing. So if you do use a donor, the donor is screened for genetic defects, infections, and high-risk behaviors. The donor sperm are frozen for 6 months. This just helps reduce any transmission of diseases that didn't show up on that initial screening. A surrogate mother can be used, so she can either do two things. She can provide her uterus only, in which a sperm and an ova are implanted into her uterus, and then she just carries that to term. Or she can have the sperm inseminated, and then she would provide the ova. In vitro fertilization, this involves laparoscopically recovering an ova and fertilizing it with a sperm. And in a lab, this is all done in a lab, then 2 days later, it is transferred back into the uterus. And this can be done either with, a partner's sperm or a donor's sperm as well. The gamete intrafallopian transfer, this retrieves oocytes into a catheter with the prepared sperm. Those ova are then injected into the fallopian tube for fertilization. The tubal embryo transfer, also called a zygote intrafallopian transfer, this is very similar to IVF, except that the ova are transferred into the fallopian tube as soon as fertilization happens. With the intracytoplasmic sperm injection, the sperm are directly inserted into the ova through a microsurgery. So these last four techniques, they all use medication to induce ovulation before the procedure actually. This just helps obtain several ova and improve the likelihood of a successful pregnancy. However, it does create a risk for a multifetal gestation. So the mother and the father, they would just need to be aware of those risks of the maternal, fetal, and neonatal complications. So some outcomes of infertility therapy, there are three possible outcomes. The first one is achievement of a take-home infant. So the couple might have some anxiety if they've had previous failed attempts at conception, or just because this is a totally new, a new concept for them. So maybe they have not prepared for the birth, both emotionally and physically. So you just need to be prepared for that as a nurse. The second outcome is an unsuccessful therapy. So this could lead the couple to discuss adoption, depending on what age or what race of child they want. There might not be a child available at the time, so they might have to deal with waiting for the market to open up again. They also could have a fear of having a successful conception after adoption, in which case they might worry that they will have two children the same age, and how are they going to deal with that financially and emotionally and physically? Or they could worry about not loving the adopted child as much as the biological child. The third outcome of infertility therapy is going to be a loss of pregnancy after the therapy. So this, of course, it's going to result in a sadness over the loss of a fetus, but it is also going to give the couple some optimism because they have successfully conceived. So it's possible to do it again. They might be open to trying different options or different therapy methods. So just a few things to remember with infertility. The evaluation, they're always going to start with the least invasive procedures first, and then as they rule things out, they will advance to the more invasive procedures. So with the therapy, there are many different types. You can use medications for either the man or the woman. There is surgery, in vitro fertilization, therapeutic insemination, intrafallopian transfers, and surrogacy. But no matter what, it is ultimately going to depend on that cause of infertility, and then also, of course, the couple's choice. Then also you need to remember that there are three outcomes of infertility therapy. The couple can receive a take-home infant, so make sure you're prepared for that they might not be ready. They might not have prepared in the ways that they should have. They could have an unsuccessful therapy. There could be those adoption discussions. And then ultimately they could have a loss of pregnancy. So just be prepared for that emotionally. And as a nurse, you need to know how to care for this client no matter which outcome does occur.